Let me give you a short introduction into traditional Tibetan medicine. It's now more than a week that I'm living here in the Tibetan Hospital and getting treated for my illness, for my cancer and other things that I have in my body. And I thought it's a good moment to give a little introduction because I heard a lot. I tried to talk with the doctors. I made some research myself to better understand their approach, and I thought I want to summarize it for you in a short video. Disclaimer, yes, I have a PhD, but not in this topic. I'm very new to it, so it could be that I say things wrong or get it wrong, so please correct me. So, what I observe where we have a similarity between Western medicine and Tibetan medicine is that we have a diagnosis and we have a treatment. The diagnosis is very different because what they do is they measure your pulse, they look at your tongue like this, and they observe or analyze your urine. So these are the three main components how they try to analyze what's wrong with your body, with your energy, with your body fluids, with the whole components inside of you. And they also have CTs and modern ultrasound equipment here. They also use that, but coming from a traditional point of view, these were the main resources of getting diagnosed. The treatment, that consists of behavior treatment, that you change your behavior, you start to change your diet, drink tea or eat other things, natural remedies like pills, herbs, minerals, other kind of natural products. It's a lot about natural products. They don't have chemical compounds. So the side effects are very small from all the things that you get. And you have to take the medicine much longer than a Western medicine. So you cannot say, okay, I have a headache, I take a headache pill and it's away. They say you have to take it for 3, 6 months, 12 months, even longer. Physical treatment like massage or acupuncture, and this should all help you to get your body into balance again. Now, why does somebody get ill? Somebody gets ill if you have an imbalance. You have an imbalance in your mind or an imbalance in the three body fluids that they define, which are the wind or the lung, which is a fluid in their terminology, the trippa or the gallbladder, and the bile, or like in this area, like the slime inside of your body. And if one of these fluids is imbalanced, then you become ill. Now, what I found interesting in Tibetan medicine is they say you have all the illnesses already inside of you, and only if you get into an imbalance, then it manifests, it comes out. And I found this super interesting. Another thing that I found interesting is that these three body liquids or bodily humors, as they say, they are connected to the three, let's say, sufferings coming from Buddhist spirituality or religion or Buddhist teaching, which are the greed, the delusion, or the aversion. These are like trigger suffering in the world. And so if the mind is imbalanced, that you have a greed, you want something, or you want to push away something, you have an aversion, or you have a delusion, so you don't see the world as it is, this will affect that the body fluids, the bile, the wind, or the trippa, the gallbladder liquids, will get imbalanced. And so it's very much about the mind and the body and the environment are together, and the illness comes from an inharmony of the three components. And I think that's super interesting because what I know from Western medicine is that it's very mechanistic. You have a cell, okay, let's repair the cell, let's cut it out, let's treat it, and then it's done. And it's mainly like treating the symptoms and not the effect. And the effect could be a genetic thing, or it could be that you had bad luck or a virus or a mutation or whatever, or maybe it's a component of the mind, the body and the environment. And so the approach is very, very different, and it's much more connected, the mind and the body. And so you cannot just say, okay, I treat the body and then everything is fine. So you have to, as a patient, also like get into the whole commitment to also, you want to work on yourself as a character and you want to work on your monkey mind. Another basis of Tibetan medicine is that everything, the mind, the body and the environment consists of space, wind, fire, water and earth. These are the 5 elements that everything exists of. And so they work a lot with these elements, and then they say, okay, you have too much heat, you have too much wind, or you have too much earth or too little earth or whatever. And so these concepts for us Western are completely new and sometimes also very confusing because we don't know them. But these people, they really have a long tradition of hundreds or even more than 1,000 years of research and like applying this medicine and researching that medicine. So it's very interesting. So I learned a lot, mainly that they don't look at the body as a pure mechanistic thing, and they're not like just taking a screwdriver and start to fix something. They have really a holistic approach to health, something that we in the West always proclaim, that we should treat the whole body, the whole patient in a holistic way. But I think here, for the first time, I really experienced what Asian people or Tibetan people mean by that. And it's very interesting. It's heart and mind opening to me. And I'm very curious to keep on going with this treatment and with my, like, let's say, mind shift that I'm doing, and yeah, see where it goes. So I hope that was useful. If you have any questions or things you want to know, please write it into comments. I will try to answer them or ask the doctors. Communication is very tricky, I have to say, but I'm very, very happy to hear your feedback, and wishing you all a wonderful day. Bye bye.